Monday.
Well, it's the first week of December. We're still in flu season. Cooler air coming our way doesn't help. We're trying to stay healthy, right? Well, right now, doctors in our area, they tell us they're seeing an increase in flu cases. Dr. Jaime Snarski of Palm Beach Gardens Medical Center joins me for this morning's What's Going Around, and we are talking all the ins and outs of the flu. I've heard a lot of people, Jamie, saying they're getting this 24-hour, 48-hour, stomach flu, different from the respiratory flu, right?
Right. So that's actually totally different. So there can be a stomach flu, which is vomiting and diarrhea, and that's more of a gastroenteritis. That's not true influenza, which is a respiratory disease with cough, fever, body aches.
But both are kind of in play right now. You're seeing both either as an uptick or coming this way.
Right, we're seeing both of them at this time, and the good news is the respiratory flu, influenza that everybody's talking about and that we worry about as we get into the winter months, January and February especially, right now we're seeing minimal levels of it, so that's great. The states right above us, though, have already kicked in a little bit more, so it's coming our way. Certainly we have to be protected against it.
Let's talk about how to get better treatment. Let's talk about the stomach flu first. You got a bug, what do you do?
Hydrate. So rest and hydration and stay home so you don't infect others. So if it's the stomach flu, most of these things are viral and they will run its course. So if it's a prolonged period, if you have underlying medical diseases, certainly see your doctor. If you are truly getting dehydrated and can't manage it at home, you can take medications for nausea that you can get from your doctor as well. Now, if you have the respiratory virus, the true influenza, there's no cure for that. However, you can take a medication called Tamiflu that's like an antibiotic. It works like an antibiotic. It doesn't cure you, but it does cut down the duration of symptoms by 1 to 2 days. So that means you're back to work sooner.
And talk to me about the critical nature of Tamiflu and when you can take it's towards the beginning of your symptoms, correct?
Absolutely. So that's really important to mention because it only is effective if you take it within the first 48 hours. So flu comes on quick, so if you think you have it, get to your doctor right away because it will only work if you take it early.
All right, we've been asking for viewer Facebook questions too about the flu, and we have one up here from Morton. He asks, what is the predominant flu strain this season and does the flu shot cover it?
So right now we are seeing cases of both influenza A and B, and per the CDC, the B is actually more common right now, but the influenza vaccine covers for both. And so right now it's too early to tell if we have a strain coming out that the vaccine doesn't cover for, so it's still worth getting the vaccine.
All right, quickly before we let you go, tips for kids with the flu. My kids just had it. What do we do?
Again, hydrate, rest, keep them home from school so they do not infect others, and you have to get vaccinated. You still can get vaccinated. It takes 2 weeks for that vaccine to kick in, so get it now before January, February where it gets really bad.
And as I learned on day number 3, keep a lot of towels handy, too, for the little ones, for little things. If you have questions, too, you can email ask@cbs12.com or use the hashtag AskCBS12 on Facebook or Twitter. We are always doing this every Monday, 9 a.m., answering your questions about what's going on. Dr. Snarski, thanks for joining us.
Thank you.
Now over to you.
All right,